Hello, everyone. Today we continue with our sessions on pediatrics, and we are looking at terminologies that are used in our pediatrics. My name is Jones H.M. Okay, so terminologies that are used in pediatrics is our topic for today. All right, so first thing actually that we are looking at today is the word pediatrics. So the, this term means a branch of medicine that is related to the study of treatment, prevention, and care of children's diseases. That's what the word pediatric means. But now, when we say pediatric nursing, we are looking at the care of the sick child, and you can also add as a branch of science that is related to the study, treatment, prevention, and care of children's disease. But now, here, when we talk about pediatric nursing, we are looking at that's the care of the sick child. Well, child, this one looks at the one who grows and develops normally. That is the child. The child who grows and develops normally. That is what we call a well child. And when we say infant, we're looking at a child who is 12 months old or less. Neonate. This term refers to an infant from birth to 28th day of life. And then when you use the word child, it simply means an individual who has not yet reached puberty or individual between toddling stage and adolescence. All right, you might have noticed that in the definition of a child, I might have used the word toddler or toddling. So we need to understand what the word toddler means. So the word toddler means a child aged 1 year to 3 years. Okay. Then there's also a word known as preschool that we'll be expected to use in pediatrics and pediatric nursing. So this word means a baby between 3 to 6 years. That's what it means by preschool. School-going child. This is a child between 6 years to 13 years. And then the word adolescent means a child between 13 and 18 years. Please, you have to note that all these definitions are based on the books of reference that I was using. Other authors may have some definitions that are slightly different, but we are going to have maintain same elements in order to have a conclusive definition. So I would want you to follow definitions like I am putting them because there was research that was done before we could actually make these notes. Growth. When you use the word growth, it means an increase of the body size and its parts. The child has to grow. So meaning there will be an increase in the body size and its body parts. But when you use the word development, we're looking at an increase in the skills and ability as a result of increased complexity of the body structure. Looking at development, we are looking at change in function as growth is taking place. Okay, and you have to know that this is an integrated process that is happening during growth and development. So the word growth, we're looking more to do with the size increasing. And when you use the word development, we are looking at the change of function that happens over time. And it is an integrated process. Active feeding. It is the feeding where the child is encouraged to feed on their own. This is important in order to promote appetite in the child. That's why we're calling it active feeding. Complementary foods. These are foods that are given in addition to breast milk and started after 6 months. This is also called weaning. Okay, weaning is in type. Is in type. You can wean the child whilst they are still having other supplementary, and then you can also have total weaning, where the child stops depending on breast milk totally. So complementary foods can be given after 6 months to help or supplement on the child's nutrition, because as they are growing, the needs for nutrients also increase. So here, after 6 months, remember exclusive breastfeeding for 6 months. Because if you bring in complementary foods, you are going to affect the child's appetite. So what is meant by exclusively breastfeeding? Exclusive breastfeeding. This is giving the child only breast milk minus water and other fluids, with an exception of vitamin medicine, that is if it is needed. Grunting. This is a soft short sound which young infants make when breathing out and occurs when there is difficulties in breathing. Immunization status. This is a comparison of the child's past immunization with a recommended immunization schedule in that country, in that community. Weaning foods. Foods given in addition to breast milk from the age of 6 months, those we call them weaning foods. Sepsis. This is an absence from infectious matter or freedom from infection. When you add either to sepsis, meaning absence, so that is the absence from infectious matter or freedom from infection. Communicable diseases. So disease or diseases that can be transmitted either direct or indirect from one person to the other are known as communicable diseases. Disinfection. This is the process of removing of pathogenic organisms either by chemical or physical means. Family foods. These are foods ordinarily eaten by a family. Alright, so we move on, and now we are looking at concurrent disinfection. This means, or we can say, this is an ongoing disinfection of objects that has been in contact with the patient. Concurrent disinfection. Then terminal disinfection. This is the final disinfection of a unit and its content after a patient has recovered from a communicable disease. That is a disinfection that is done at the end or on discharge. Carrier. This is a person who harbors a pathogenic organism with his body and is capable of disseminating them to others. That one is known as a carrier. Fumigation. Fumigation means use of gas or gases, smoke or vapor for the purpose of disinfection. When you lose the word contact, what do we mean? This is a person who is exposed to a contagious disease. Pandemic. This is a condition in which a disease attacks a larger number of people at the same time or season. That is what we call a pandemic. Fomites. It's any substance other than food that may harbor or transmit organisms. When we use the word endemic, we simply mean a disease which is more or less in an area continuously. Barrier nursing. This is the nursing care of a patient with an infectious disease, and adequate precaution is taken so that the infection does not spread to others. Barrier nursing. Now, when we use the word reverse barrier nursing, we mean isolation of a non-infectious person who is prone to infection. Host. This is an animal or a person on which or within which a parasite lives. We have used infection from the time we started our lessons, and today we want to define what an infection is. So, when we use word infection, it simply means an invasion of the body by pathogenic microorganism that causes disease. And when we say infectious disease, we simply mean a disease that is caused by a pathogenic microorganism. Quarantine, quarantine. So, what does it mean? It is a form of isolation by which freedom of movement is restricted, sick or well, as long as they have been exposed to contagious disease. Incubation period. One word that we are those two phrases that we are going to be using most frequently in our pediatric lessons. So this means an interval between exposure to infection and appearance of the first symptoms. Inoculation. This one just means an introduction of material containing microorganisms or their products into the tissue. Inoculation. Invasion. Invasion, we simply mean the entrance of bacteria or other infectious diseases into the body and their distribution into the tissues. Invading, invasion. Children have rights, just like adults, nurses, and the likes. So children have rights. So it's important we familiarize ourselves with the rights of children when we are studying pediatrics. So the first right is the child has the right to life and health. The child has the right to freedom and dignity. The child has also got the right to family and community life. The child has the right to education, culture, sport, and leisure, and all these must be provided to avoid infringing on children's rights. The other rights include that the child has got a right to a profession and to protection at work. Okay, what are the principles of pediatric nursing? A nurse must be established, or a nurse must establish a therapeutic relationship which is necessary for providing quality care for children. A therapeutic, a relationship that helps in healing the patient. A relationship that helps promote healing. That is a therapeutic relationship. A nurse has to establish that. You have to establish a good rapport, build trust in the child so that you have a therapeutic relationship. The nurse has to assist children and their families in making informed decisions and acting in the child's best interest. As a nurse, you can explain the disease process to the parents and act as an advocate in order to ensure that the child's best interests are not taken advantage of. The nurse must be knowledgeable in most of the conditions in order to provide quality care for the child's optimal and physical well-being. This is important and it is done through continuous education, just like the one we are having right now. Other principles of pediatric nursing is that nurses should be demonstrating a caring spirit, expressing compassion and empathy to children and their family members. It's not easy to have a disease within a family. Hence, it's important we show empathy. The other principle is that every nurse in childcare must practice preventive health. Children are prone to a lot of diseases, so it's important the nurse practice preventive health. The nurse should be gentle in handling the child. This becomes very, very important for you to build a rapport with children, and you also build the trust because they are center of love. Mostly is the mother. They get to love you, then you can nurse them very well. All right, we move on to the other principles. So the nurse must identify each child with reference from where they are coming from, as this helps to determine how well the child is looked after. Remember, social factors, cultural factors affects children's development. So when you are equipped with that from your sociology of medicine, it helps you to know some of the problems that they may have. In some religious cycle, you find that uh, immunization may be looked at in a negative way, so the child may not have proper immunization. So it's the duty of you as a nurse to educate them so that you can help determine how well the child is looked after. The other principle is that the nurse has a responsibility to influence the intellectual, physical, and emotional feeling of the child. Therefore, show love and empathy. Once you win the child's love, your responsibility to influence the intellectual, physical, and emotional feeling of the child becomes easy. Alright, so we're looking at probably the last principle here, and that is the nurse, as a member of the healthcare team, must collaborate and coordinate the nursing services with those of other professionals. There are some duties that may call for physiotherapists, there are some duties that may call for a pharmacist, and others. So the nurse should ensure that all these are well corroborated for easy and quick recovery of the patient. So the nurse and the sick child, that is subheading, the nurse and the sick child. It's very important for a nurse to identify children's needs, which can be classified in the following categories. Adequate provision of care. Is the provision of care adequate? So you, the nurse, with the sick child, you can make assessments and establish this. Protection from physical danger like accidents and infection. Children are prone to a lot of injuries because they are too active and their perception might be not that good on certain things, so they are prone to injuries. Protection from psychologically threatening environments. Children have emotions just like adults. So, in an abusive environment, the child may be affected emotionally. So, you, the nurse, and the sick child here, we are saying you can identify the problem where this is concerned and offer some kind of protection from psychological threatening environment. And here, this may call for collaboration with other professionals. The other one is that the pediatric unit must be built and furnished to meet the patient's needs. A pediatric ward should not look like an adult ward. Put in certain things that will impress the child. Dinosaurs, pictures of A, B, C. That makes the environment look more friendly to children and it interests them to look at those things. The room for the sick child should be near the nurse's station. This is simply for easy observation. Alright, so I'll give you an assignment on some other terminologies that we might not cover fully within this, and you have to do a presentation. Please, through our Google classes and Google Hangouts, we can always discuss this. Okay, the assignment, and we are able to help you. Historical development of pediatric nursing. All right, so when you know the history, you understand where you are. When you know the history, you are going to respect where you stand. So previously, there were no special treatment for children and no special hospitals. But by 1802, people started thinking critically, and the first children's hospital was opened in Paris, France. America followed and opened the Children's Hospital in Philadelphia. The Great Ormond Street was opened also in Europe. So, how is the rise of pediatric as a specialty? Dr. Abraham Jacobs, a German doctor, was convinced that children's conditions were different from adults. Hence, with his studies, he thought the need for pediatric as a specialty. By 1870, he became a professor in America. In 1888, he helped in the formation of the American Pediatric Society. So in the 1896, Dr. L. Emmett Holt wrote a pediatric book, and this book is still on the shelves as I speak today. In 1888, first department at Harvard University and medical headed by Dr. Thomas Morgan Roach also was established. By 1913, we had a full chair that was established at Johns Hopkins University by Dr. John Holland. Pediatric nursing development will continue. So we also had a parallel to the above development. Special units for children were also being opened, and general pediatric nurses were also being trained. So later specialties for children were introduced, e.g. sickle cell in children, nutrition, and the likes, depending on how the need was rising. The changes in nursing care of hospitalized children was changed and improved because of this specialty and changed perception. This improved care eventually for children. So many advances in nursing have been discovered, like the kangaroo method of taking care of premature children that was discovered in Brazil. And in 1970, White House Conference was made to talk about children's care and well-being. I thank you most sincerely, and please remember through our Google Class and our Google Hangout, we are going to send you the assignments and we are going to have a discussion on how the other terms that are relevant to the syllabus can be tackled. So I thank you most sincerely, and God bless.